Hello, hi. This is a physical examination of a young male with progressive abdominal pain. We will begin with the introduction, and I, Daniel, will be your curator for today with the assistance of Shafi Ahmed and Dr. Ng. So, I will begin with introduction of myself and gaining the consent and asking the patient if he is okay to expose his abdominal area for physical examination. We begin with the hands, forearm and elbow. Beginning with the nails, what we're expecting to see is leukonychia, which is the white bedding of the nails, koilonychia and clubbing of the nails. So going to the palm, what we're going to expect to see is palmar erythema. Palmar erythema is usually due to excess estrogen associated with reduced hepatic breakdown of sex steroids. Next, we will ask the patient to sit upright while raising his hands to see if there is any astraxis or coarse flapping tremor which occurs with hepatic encephalopathy. Next, we are going to go up to the elbow and see if there is any appearance of needle points which will lead him to be a drug abuser, or any tattoo marks or scars. Going up to the neck, we will ask the patient to tilt his head to the left to expose his jugular vein, and we will see if there is any appearance of spider nevi. After that, we proceed with the face. We would like to assess the general appearance of the face, if it could be pale or if there is any appearance of rash. Going to the eyes, we would like to see the general appearance of the eye. If it's dry, it is known as xerophthalmia. We will ask the patient to look up and down. Using one finger, we will pull the upper lid and the lower lid to see if there is any appearance of anemia and jaundice. Next, we will ask the patient to open his mouth wide, and we will see if there is any ulcers, angular stomatitis, and detect if there is any fetor hepaticus, which is the mousy smell. Next, ask the patient to protrude his tongue to see any appearance of red strawberry tongue due to iron deficiency anemia, any glossitis, and any ulcers. Next, we are going to proceed with the abdominal physical examination consisting of inspection, palpation, percussion, and auscultation. For inspection, we look for the pattern of breathing, scars, gynecomastia in male, and breast atrophy in female. We begin the process by exposing the patient's abdominal area. Examine the patient in good light and warm surroundings. Position the patient comfortably supine with the head resting on only one or two pillows to relax the abdominal wall muscles. Expose the abdomen from the xiphisternum to the symphysis pubis, leaving the chest and legs covered. So we begin with the palpation of the liver to see if there is any enlargement of the liver. Then we will ask the patient to take deep breathing. So from here we will feel if there is any liver that can touch the hand. Ask the patient if there is any pain. We continue with the percussion of the liver. If it's dull, until it reaches the part which is resonant, the liver ends there. What to check from percussion is ascites, dullness to resonance, hepatomegaly, and splenomegaly. Then, we palpate for the spleen. Ask the patient if he got any pain. We begin the percussion of the spleen. Usually, it is resonant throughout. Then, we continue with the general examination of the whole intestine to see if there is any mass, ascites, or any hernias. Ask the patient to pinpoint if there is any pain. From the video, the patient had pinpointed that he had problems with his intestinal area, that is pain there, and we would like to assess his history if there is any constipation, dysuria, or any pain during defecation. Now, we begin to check for ascites, which we do percussion, and there will be shifting dullness. We continue with auscultation. With the patient supine, we place our stethoscope diaphragm to the right of the umbilicus and do not move it for 20 seconds to assess bowel movement. Listen above the umbilicus over the aorta for arterial bruits. Normal finding, bowel sounds are gurgling noises from the normal peristaltic activity of the gut. Abnormal findings, that is, absence of bowel sounds, implies paralytic ileus or peritonitis. Now, listen over the liver for bruits. Next step is the leg inspection. From the leg inspection, we would like to see if there is any ankle edema by putting our finger at the ankle and leaving it be for 5 seconds and removing it to see if there is any flexure left.
Then we did our hand, see if there is any flexure of what we press.
If there is any edema, we see how far the edema had progressed. Rectal examination. Yay! Why we do rectal examination? To see if the patient is actually suspected of appendicitis, or maybe if there is any rectal bleeding or iron deficiency anemia, maybe there is malignancies of unknown origin, or to see if there is any pelvic abscesses.
Hello sir, I'm Daniel, junior doctor, and I'm going to perform to you a rectal examination. I hope you are okay since we are going to access your inner root, and I'm going to gain your consent from here. Are you okay? Okay, thank you. So what we're going to do is we're going to ask you to expose your anal area, and I would like you to remove your underwear and your pants right now. After this, I'm going to call my chaperone to help you, and we will begin immediately.
So, we're going to prep up materials with a tray on the table, a sanitizer, a KVE lubricant, a pair of gloves, and a couple of tissues. Sanitize your hand with the sanitizer that you've provided and let it dry. Once your hands are dry, you can start wearing the gloves which fits to you best. Place a blue sheet on the bed for the patient.
Okay sir, I hope it's okay that you would lie down to your left hand side because it will ease my process on exposing your anal canal. So we're about to begin the process. Okay sir, I would like you to stretch your legs so it will show your anus better. And I'm about to introduce to you a lubricant gel which I'm going to put on one of my finger, and it will ease the aid of my finger into your anal canal. Okay, I'm going to start the process, so please bear the pain for a while, okay? So I'm inserting my finger to your anus, and I'm going to rotate 360 degrees to assess your anal canal. Okay, sir, can I request for you to strain your muscle so it will help me on my process of investigating your anal root? Stop. Use the tissue to clean the excess lubricant that is around the area, so there will be no discomfort to the patient. Thank you for your time. I'm going to close your part right now. So after this, if you felt any discomfort or if you have any bleeding during defecation, you should just inform me so we could have a better investigation. Thank you for your support and cooperation.